All right, today we're jumping into a health story where the main statistic, the one you always see in the headlines, it doesn't even come close to telling the whole story. In fact, it kind of hides a reality that's way more complex and honestly pretty urgent.
So that really brings us to the core question, right? What is actually hiding behind these big dementia statistics? Because as you're about to see, a single number can be totally true, and at the same time, incredibly misleading.
Okay, so let's get right into it. When you first look at this, the story seems pretty simple and actually kind of positive. The data shows that, as a whole, Asian Americans have lower overall rates of dementia than white Americans. I mean, on the surface, that sounds like great news, doesn't it?
But, and this is a big but, that one simple comparison, that one number that seems kind of comforting, it's masking a picture that is so much more complex and honestly, so much more critical. We really need to unpack this to see what's actually going on.
So here's the headline number. According to the CDC, people who identify as Asian American make up about 8.4% of all Alzheimer's and dementia cases. This is that top-line statistic, the one that gets reported out and really shapes our basic understanding of the issue.
But here's the huge problem with that. A single number like this is deceptively simple because it treats this vast, incredibly diverse population as if it's just one single, uniform group. And that's exactly where the real story starts to get buried.
So let's dive into the data. We're going to break down that one big statistic and really try to uncover the story that it's hiding.
And this is absolutely the crucial point. The term Asian community is just a massive oversimplification. I mean, we're talking about an umbrella that covers dozens of distinct cultures, different ethnicities, totally different backgrounds, diets, you name it. So lumping all of that together for health data, it can be seriously misleading.
Now, check this out. This is what happens when you actually break the data down. A huge 14-year study did exactly that, and what they found was fascinating and really significant. They saw huge differences. Filipino Americans had the highest dementia rate among the groups they looked at. Then you have Japanese and Chinese Americans, and South Asian Americans had the lowest. All of a sudden, that simple, uniform picture, it completely shatters. Now, researchers are still digging into why. It's probably a super complex mix of genetics, lifestyle, diet, but the big takeaway is crystal clear.
But, and this is important to get right, even with all those variations, the research confirmed that every single one of these subgroups still had a lower overall dementia rate than white Americans. So that top-line number we started with, it's not wrong, it's just incomplete. It completely hides all this crucial detail.
Okay, but this whole story isn't just about the numbers and the prevalence rates. We've got to look beyond the data, because there's this other powerful, almost invisible force at play here that the stats just can't measure, and that's the heavy, heavy weight of cultural stigma. And that really brings us to the heart of the matter. You might be asking, so if the rates are lower overall, what's the big challenge? Why is this so urgent? Well, the answer isn't just about the disease itself. It's about how we as a society respond to it. So when we talk about cultural stigma in this context, what do we really mean? Well, it's about these really strong social pressures. It can show up as a deep feeling of embarrassment, or this belief that dementia is just a normal, unavoidable part of aging, or even the sense that it's just fate and there's nothing you can do about it.
And this quote just hits it home. It shows you how personal and powerful that feeling can be. A 2017 study that was trying to understand attitudes in the Chinese American community found this exact phrase kept coming up: being embarrassed about having a relative with Alzheimer's disease. Just think about that. That one feeling, it can be enough to stop a family from ever asking for help.
And if that internal stigma wasn't enough, there are external barriers too. Get this. According to the Alzheimer's Association, more than 1 out of every 3 Asian Americans says they've faced discrimination when trying to get care for Alzheimer's. 34%. I mean, that is a staggering number. And just to put that number into perspective, take a look at this comparison. That 34% for Asian Americans is up against just 9% for white Americans. That's not a small gap. That's a chasm. It points to a really profound difference in the actual healthcare experience.
So you have to ask, what's the real-world impact of all this? How does this toxic combination of internal stigma and external discrimination actually cause harm?
Well, it sets off this really destructive chain reaction.
It all starts with that feeling of embarrassment or that idea that it's just fate. And what does that lead to? A reluctance to even talk to a doctor. The result of that is a delayed diagnosis, which means delayed treatment. And that ultimately leads to poorer health outcomes, more isolation for the person with dementia, and just immense stress on the whole family.
But here's the thing. This is not some unsolvable problem. The research is actually very clear on this. There's a powerful way forward, and it all starts with one of the most basic tools we have: education.
Because really, the best antidote to stigma, to fear, to all that embarrassment, it's just understanding. As soon as we start replacing myths and misconceptions with clear, straightforward knowledge, we begin to dismantle the power that stigma has.
So, what kind of education are we talking about? It's really about giving families a toolkit, teaching them the actual difference between normal aging and dementia, helping them spot those early symptoms, giving them real practical strategies for caregiving and managing their own stress. And this part is so crucial, making them aware of the financial and social help that's out there for them. All of this knowledge empowers families to take action and to do it sooner.
And that really leaves us with this final thought. The data is one piece of the puzzle, for sure. But the real challenge here is cultural. So the question for all of us is, how can we build communities where asking for help isn't seen as a weakness or a source of shame, but is recognized for what it is, a profound act of strength and of love? Because that's the shift that will truly, truly make a difference.